This is Jerry Hesch with the Hesch Institute in Las Vegas, Nevada, actually very close in Henderson, Nevada. And this is our case on chronic foot pain, cuboid syndrome, question mark. Our website is www.hes like Sam, CH, institute.com. And we treated Kyle yesterday, and we showed in part 2 that we had a considerable gain in motion throughout the foot and ankle. Today we rescreened him, and we have he has retained that gain in motion. So today we want to focus more on subtle motions, and we did in fact find some subtle reductions in motion. Yesterday he had reduced hip internal rotation, and if we look at the left side, testing rotation of the hip in supine, that looks to me like about 35 degrees, and you can see there's a soft end feel. On this side it looks almost equal, but there's a hardness at the end of the range. This is called the end feel. This one actually looks like it might be 30, whereas the other one was 35. So we have a little bit more room to gain. You can also do a spring test underneath the trochanter. You can do a very general one. In prone, it's a little bit more specific because the pelvis is resting against the table. But even doing it in a general manner, I feel that there is greater restriction on that side. The other restrictions that he has, I'll show you that with gross movements, he's got abduction of the foot, and we're allowing the ankle to participate, and you can see that he has much freer mobility of his calcaneus. That was absolutely absent yesterday, and if we block the ankle joint by squeezing the medial and lateral malleoli, you can see that there's still subtalar motion on this side, and there is, he can go into eversion. The motion that I find restricted is in posterior glide of the tibia. It might be hard for you to see these on the camera, but I can glide the tibia posteriorly and I can spring it, and on his affected right side it's very, very hard. I cannot induce motion with a normative spring test. I'm trying to spring it, not going. His strength is much improved. Can you invert? Yeah. Show me how strong you are. Okay. And then you want to evert, go laterally. So he is a lot stronger, and so there was an inhibition of muscle function. The other subtle restrictions are in dorsiflexion. At end range, he has reduced abduction of the foot, where the forefoot goes to the right. It goes laterally. So in this position, he goes just past neutral, maybe that's 5 degrees. And if you contrast that with the unaffected side, that looks to me like 10 degrees. And this has, maybe it's 15, has a normative springy end feel. On this side, he goes just 5 degrees, and it's a rather hard end feel. So we're really in the subtle function here, and we want to test plantar flexion on the unaffected side. When we test abduction going outward, which is part of pronation, especially in dorsiflexion, looks to be about 10 degrees and with a springy end feel. And on this side, oh, he goes so very little. Okay, he's in end range plantar flexion. I'm trying to abduct. I can feel it. I'll bet it's going maybe 3 degrees or so, but very, very hard end feel. All other motions are much more normative. Perhaps there's some other subtleties, but I just can't discern them. Let's have you lie on your stomach with your feet off the edge, please. Might be a little easier to see the subtalar motion from this angle. So on the left side, you can see that eversion goes essentially to neutral. You can see the forefoot lies in about 10 degrees of valgus. And we can bring the heel in, and when we abduct the calcaneus, of course the foot follows, you can see that the whole foot goes laterally. That was absent yesterday. So if I stabilize here, I can abduct into neutral, and you can see the plane of the forefoot. And then in terms of testing abduction, he has a soft end feel there. So that motion is much improved. We did test motion at the malleoli. It's a very subtle motion, but it does have some spring. It feels like a very, very strong spring that you can just slightly move. And in comparing the fibular head, which is by appearance much more normal, the tone in the soft tissues is much more like the left side. And I can load it and induce a tiny amount of yield, whereas yesterday that was stuck. So today's purpose is just to show that he's retained the benefit, because every time he walks, now multiple joints participate in pronation, but there are subtle motions that we really need to address, and so we will do so. And thank you.